Up. In the meantime, we continue our COVID-19 talks with Dr. Amanda Novack from Baptist Health joining us live today. Dr. Novack, thank you so much for joining us today. I want to begin with something that has been a topic a lot of people are talking about right now. Continued questions surrounding the vaccine and infertility, now talking about men. Dr. Fauci recently speaking out against this. Is there any truth to these claims?
Right. There's really no scientific or medical reason to believe that the vaccines are associated with infertility or with impotence. You know, infertility happens, impotence happens, and sometimes that will happen in someone who happened to get a vaccine. I had an uncle that used to say, coffee will kill you because my grandpa drank coffee and now he's dead. And that's sort of the association between vaccines and infertility. There's really no scientific reason to believe that there's any relationship. Even if I could speculate and come up with a biological reason that the immune system is attacking the fertility organs, we would see that exact same thing with actual COVID infections. We know that the side effects of the vaccine, like the myocarditis and the blood clots that are extremely rare, are much, much more common with actual COVID than they are with the vaccine. So even if we did think that the vaccine could cause infertility, which we do not, but even if we did, the concern would be that COVID infection would cause that even more.
How interesting, very interesting perspective there, Dr. Amanda Novack, thank you. Let's talk about Labor Day. Going into the holiday weekend, people are more comfortable being out. We expected big crowds. We saw big crowds. We're now at the point that we can look and say, was there a spike from the holiday weekend? Did we see one from Labor Day?
Right. And I think that shows that even with all of our expertise and all of our science, nobody knows the future and nobody can really predict this virus. We all have to be kind of humble about what we understand. Right now is about the time that we would expect to see numbers going up. And certainly we are seeing individual people who are testing positive now who had an exposure around Labor Day weekend. And so clearly that did happen. But in the numbers and the volumes that we thought or that we were worried about, we haven't seen that sort of uptick. We're not quite out of the woods. You really want to make sure you've got a couple of doubling times. So not just the people that were exposed that weekend, but then the people that they exposed. So sometimes it can take 2 to 3 weeks to really see an uptick. But the truth is, very happily, we have not seen the sort of devastating numbers. And some of that's just, there's not that many people left who haven't had COVID yet or been vaccinated.
And talking about the holiday weekend and packed crowds, college football has started. Stadiums are packed. We saw, I believe, 74,000 packed into Razorback Stadium, which was a glorious moment because we beat Texas. It was amazing. But do you expect to see a spike in cases in Arkansas, in Northwest Arkansas, following these events?
You know, it was a really, really great game. I mean, one of the best games I can remember in Arkansas history. And one thing working in favor of the 74,000 people there is that it was outdoors. And so this virus really, it disseminates in the air outdoors very quickly, and it doesn't tend to be transmitted in those sorts of situations very much. Now, as far as all the activities that go around that are indoor activities without masks on, you know, there was a lot of community gathering that weekend, and so there's some concern that there will be some increased cases around that. But for whatever reason, even with big crowds, as long as it's outdoors, we just don't see the same kind of transmission that we see in indoor events.
That's good news. Even more reason to celebrate that big Razorback win. Dr. Amanda Novack, thank you so much. We appreciate you as always.